Hi, I am Dr. D. Madhu, Senior Consultant Surgical Oncologist and Robotic Surgeon from KIMS Hospital, Secunderabad. We will discuss today about pancreatic cancer, what about its incidence, what are all the risk factors, what are the symptoms with which pancreatic cancer presents, what are the treatment options available, and how can you modify your risk factors to bring down the incidence of pancreatic cancer in this society. Pancreatic cancer generally presents with certain kind of symptoms like loss of weight, loss of appetite, and jaundice. This specific jaundice associated with pancreatic cancer has pruritus, associated itching. This is very characteristic for obstructive jaundice associated with pancreatic cancer. Along with this, there will be a change in the color of the stools and the diarrhea called steatorrhea, and also sometimes back pain or epigastric pain. Certain patients may have ascites, that is distension abdomen also. These are all various symptoms with which a pancreatic cancer patient can present. What are all the risk factors associated with pancreatic cancer? Certain patients have smoking history, alcohol intake, patient is a known diabetic, chronic since a long time, and sugars are uncontrolled, and certain patients have family history called hereditary pancreatitis, especially seen in certain parts of India like Kerala. All these patients, they may have association with the incidence of pancreatic cancer, but most of the patients present without any specific cause. So already I discussed about the presentation of the pancreatic cancer patient. Now with these symptoms, these patients have to approach 4 kinds of specialists: general surgeon, surgical oncologist, medical gastroenterologist, surgical gastroenterologist. If you approach any one of them, they will get the appropriate treatment. Initially, when they come to us, we evaluate with an ultrasound abdomen and pelvis and upper GI endoscopy. With these 2 investigations, we will get a preliminary idea about the clinical situation, where after that we are going to advise next level of investigations, that is a pancreatic protocol CT or a triphasic CT. With this CT scan, we are going to delineate the extent of the lesion and close abutments to the adjacent major vessels surrounding the pancreas, and any metastasis to the liver or surrounding lymph nodes, and any fluid in the abdomen, and anything else also can be understood from doing a pancreatic protocol CT. Once this is done, suppose if the diagnosis is confirmed, that's okay. If endoscopy, if we are not seeing anything, we are going to advise endoscopic ultrasound guided biopsy of the mass lesion in the pancreas. Once all this evaluation is done and the disease is proven, the patient will be taken for the surgery according to the criteria for the resection. So based on the location of the tumor, we are going to decide the surgical plan. Suppose if the tumor is in the head of the pancreas, we are going to do Whipple's procedure. If the tumor is in the neck of the pancreas, we are going to do central pancreatectomy. Suppose if the tumor is in the body and tail of the pancreas, we are going to do distal pancreatectomy. Among these, the Whipple's procedure is the most technically demanding procedure, which is done through open laparoscopy and robotics. It has evolved, and open procedure patients used to stay in ICU, a lot of morbidity, which got shifted to less morbidity after shifting to robotics. And robotic Whipple is the procedure that's going to help the patient. Even less than 1 day ICU stay or hospital stay is brought down, and especially during reconstruction, it is having a technical advantage, and this is going to help the patient in his or her recovery. And suppose if the surgery is not possible in these patients will be given other treatments like chemotherapy and radiation to facilitate the patient to come to surgery in the future. Suppose if surgical option is totally ruled out, this patient will be given palliative treatments like palliative chemotherapy, and any suppose symptoms are there, triple bypass procedure which will be done by surgery or some endoscopic procedures also, you can be able to palliate these patients and bring good outcomes in these patients. And most of the patients, they need not worry. If they are detected in the early stage, the results are excellent. If this diagnosis is delayed, then the results are poor. So try to get the things early, get screened, and when the symptoms are there, you get it done, evaluated by the specialists concerned, which is going to help you in building up your life and being healthy. Thank you.